adult rheumatologist can be a little bit scary, but if you know what to expect, it might make the process a little bit easier.
I've been at Sick Kids since I was 2, so I've been here for 15 years in the Sick Kids clinic, and I have to move on to an adult clinic coming up this next year. And I'm not really nervous because I know that I'm strong and I can deal with it myself.
So going to an adult facility, obviously I didn't know anyone, and it was a little scary, but I mean, the people there are just as friendly. I think sometimes it just seems like they're busier.
I think that the transition will be really easy.
It will be up to you to take responsibility for your arthritis, what kind of exercise routine you should do, what medication to take.
When growing up, being a child with, a disease in the family, you kind of instantly become the baby of the family, someone that everyone wants to take care of, and I think that's completely true for my mom, and so I think she's having a hard time accepting I'm an adult and that I need to take care of myself and be independent while, she wants to take over and do her mother thing.
This is your healthcare appointment, and you're going to be the one taking responsibility for your arthritis.
You're used to your mom being there, or your father being there at every doctor's appointment, and being on your back while taking your medication, your pills. And now that I don't have my mom with me at all my appointments, it's kind of weird. Really gets kind of lonely. And so I still call my mom up and just try to get her to force me to do stuff, get her to encourage me.
So it's important that you learn all you can about your arthritis, about the medications that you're on, what medications you've been on in the past, about your past health history. Ask your parents questions if you don't know the answers, and learn all you can so that you can provide your new doctor with the information they need.
Talk to other people, find out who has it. There are more people than you would think. By talking to other teens with arthritis, I know that I'll be okay by myself and everything will be fine.
And there are those feelings of not being able to take care of yourself and being dependent on other people. And it's really difficult because I still feel those some days. To not be able to look after myself and not feeling, and in many ways it makes you feel like you're not an adult just because you can't do something as simple as wash your hair. I have learned to deal with that because ability does not determine me being an adult. Just because I can't do something one day doesn't mean I don't have the capacity to do it another day. I kind of, just try to put myself into this day and be like, today I can do something, today I can do what I want.
In the future, I plan on going to university, hopefully getting a job, and just living my life as I would if I didn't have arthritis.
It is impossible for your doctor to really predict what will happen with your arthritis or if it will last into adulthood. As it stands, about 60% of children and teens with arthritis will have active arthritis as adults. Also, the longer your disease remains active, the greater your risk of having joint damage.
I'm constantly afraid for the future about how my body could deteriorate, and I kind of feel like I have to live up now as much as possible.
Your healthcare team will follow your symptoms to see if they follow any patterns of ups and downs. They can use this information to give you a general idea of what to expect in the future.
Although my arthritis won't disappear, I know that I'm going to be okay and I'm going to be able to go to university and live a normal life as long as I believe in myself and I keep going to doctors and keep taking my medicine. So I'm not worried about the future because I know that I'll be okay.
What I've gone through has given me strength. It's made me closer to my family. It's made me more solid as a person. You know what? I have a disability, but it makes me just, if not more of a person than less of one. I feel more in touch with the bigger ideas of life, family and identity, and I feel more connected to that than I think a lot of people would.